Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. K. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Good morning, everyone. Welcome back to the Mom with Moms podcast. We have a very special episode planned for you today. It is October, which is Breast Cancer Awareness Month. So I do have a wonderful partnership with the folks at HerSpace, the Med Spa, and also, which is their sister partner business practice, which is Little Silver HerSpace, and the wonderful team that gives women mammograms in our community. So we are going to be talking about mammograms today, about breast cancer, about questions that you might have. I'm going to actually go into a little bit to my own story about my first experience. I just turned 40, receiving my mammogram, which was very fitting because we're welcoming Suey Williams today, X-ray technician and specializing in mammography. Welcome. Thank you for joining.
Thank you for having me.
And you actually gave me my first mammogram, which was not planned. I don't think this was planned this way. It just kind of worked out that you ended up coming on the podcast.
And I was honored to be your personal mammotech.
Yes, thank you. So tell me a little bit about your background.
My background began about 44 years ago.
Mm-hmm.
I started working as an X-ray tech. I always had a passion to take care of people, and I didn't know which environment I wanted to do. So I had the opportunity to do a 2-year program, get my degree real quick and start working. And I began that in Long Branch at Monmouth Medical Center, where I did 20 years and I did all spectrums of radiology. And then I decided one day I needed to take my skills and my talent and all my passion and put it towards saving ladies' lives from breast cancer, being part of the big team. Because it's important what the technologist does in order to properly position the breast during a mammogram, to allow the radiologist to see all the tissue. So that's what I've been doing for the past 30-some years. And it just brings me a lot of joy to help someone. And I will continue to do it till I fall down because I just love it so much.
It's incredible. It must be, I can't imagine just, each and every day and then having to be there with someone during their, a really, really hard time. So a lot of questions I have. I will say one that I turned 40. So one of the things that I know is like when you check a box, it's that you're supposed to go get your first mammogram. So we did schedule that, and it was good timing because I do work with, the team at HerSpace, and I love the idea that I was able to spread awareness. So I did post about my experience and all of it. And in doing so, I kind of went into it because I was half working where like I had to, make sure I was getting the video content and stuff that day. But while being there, it kind of dawned on me that like I was getting my first mammogram and that you find out whether or not there might be an issue that day. And so kind of this like terror and dread, like came over me, and not because of the experience, but just because of the, possible outcome, which is, I think, you hear a lot about like women, reminders to go get your mammograms and then the experience itself. And I actually, my sister-in-law was like, are you scared? And I was like, no. But I didn't realize that that's why she said that, because I'm sure a lot of women feel that way. So, so tell me like, what your day looks like and, what women experience if they're the first time or, if maybe it's their 50th time going in, but what does it look like each day?
Well, like you mentioned, it is a very high anxiety day for most ladies that come through the front door.
Yeah.
So our mission at Little Silver HerSpace Mammo is to welcome them, to embrace them. And the most important thing I feel is to listen. Listening is the key to success when taking care of women in this position. Some of them have been coming for so many years, but they're still fearful. Some of them, they play it off, oh, no big deal, I'm just coming for a mammogram. So we have to adjust and be able to provide excellent service to anyone. Sometimes they'll cry. Sometimes they don't even want to get in the cape. Mm-hmm. They're so nervous. So we're all of us have a lot of years of experience. Mm-hmm. I'm not the oldest technologist there. There's 3 mammography technologists, and we're very talented and very considerate to our ladies. And we also have a team of ultrasound technologists that provide the same care. But my normal day for myself is we're very productive. Mm-hmm. We're very well known in the community.
Right.
And one of the big attractions, besides our skill level, even the doctors are top notch, is that we do same day results. When you do go to other facilities, the only time you're really going to get same day results is if you go in with a symptom or a problem, and that's a diagnostic. Those facilities will provide you the same day results, but normal screening, you may have to wait a couple days. And if you do have to have additional imaging, you may have to then wait again.
Okay.
When you come to HerSpace between the hours of 9 and 2, we provide same day results.
Okay.
So you wait, if there is a finding, we'll work you up. If you need ultrasound, we also provide that service.
So is that something that if it's your first time, like I know for me, I think we did what's the first thing called where like the actual mammogram, right?
Correct.
Okay.
Yes.
And then from that, it was determined that I needed an ultrasound because I have dense breasts, correct?
Yes.
Okay. But not everyone gets the ultrasound.
No, not everyone needs the ultrasound.
Okay.
There's 2 types of ultrasounds. They're the screening ultrasound that helps to embellish a negative mammogram. Mm-hmm. And that's based on if you have dense breast tissue. The radiologist is the one that will determine if you have breast tissue that is dense.
Okay.
It's actually, there's a lot of whiteness on your mammogram, and a breast cancer appears white as well. So if you have dense tissue, that that cancer could be hiding. So those are the ladies that would go on recommended to go have an additional screening test. Doesn't replace mammography. Mammography is the gold standard tool to save your life. Mm-hmm. But we also use ultrasound, just say if a woman comes in and they have a palpable lump or they have breast pain or a discharge of their nipple, the doctor will recommend a targeted ultrasound just of that specific area. We also will do ultrasound if there's a finding on the mammogram, such as a mass. Most of the things that we identify, this is a great part of our day. It's not breast cancer.
Okay.
So you have to be aware that if the radiologist is asking for additional imaging, either under mammo and or ultrasound, it doesn't mean it's something bad. It just needs further attention, and those additional imaging studies can give a lot of information to sort it out.
Okay. So it's recommended once a year. However, can something develop like rapidly? Say you had a mammogram and everything looked fine, but like a few months later you develop something. Does that happen?
That does occur.
Okay.
And you shouldn't sit and wait on it.
Okay.
The first phone call should be to your physician. Mm-hmm. You would want to get your doctor to examine your breasts, mm-hmm. and then they would order the proper testing, such as either mammo or ultrasound.
Okay.
And never ignored any symptom. There's never a silly symptom in the breast.
Okay.
Don't take it upon yourself to keep it within. Share it with your doctor.
So you are very passionate about your field. Tell me why you chose to get into mammography.
I decided after starting in general radiology, which includes going to the OR, going to the ER, I lost my mother when I was 5, mm-hmm. and it was from breast cancer. Back in the day, in the late 60s, they really didn't have a lot of knowledge, and the ladies that were in their 30s, they weren't being imaged. It was, if I recall correctly, because I am an older woman, it was in the 50s you would start your baseline. Now it's 40. So I just decided that I was really doing a lot of good for in other walks of radiology, but I had a dream, and it was my mother was in my dream, and I couldn't do mammographies until I had this dream, because I didn't know my mother passed away till I was in my 20s.
Okay.
And I was like, when I found out she passed away from breast cancer, I was like, oh man, everyone will be passing away. But that's not true because of the technology. It's all about coming in to have your mammogram punctually. Don't delay what you can do today. So one day I had this dream. She woke me up in it. She slapped me across my face and she said, Suey, go save the world. You have to go because you have so much talent. And that's when I said, I'm going to mammography. And that's when I had the opportunity to start the breast center at Monmouth Medical.
Wow.
And I'm so happy I had that dream with my mom lead me to where I belong.
Yeah, of course. That's amazing. So the breast center is still at Monmouth Medical?
It is.
Okay.
Yes.
Okay. So tell me if you are, perhaps someone that is in your 30s and you have maybe a mother or a sister or a family member that has experienced some issues with breast cancer. Is it recommended that you still wait till you're 40 or, should you maybe perhaps get mammograms earlier?
Yes. So the guidelines currently are if you're a woman of age of 30 or higher, even if you have no family history and you discover a lump, we will do a mammogram.
Okay.
If you're under the age of 30, if you have a symptom, we'll do an ultrasound. Now, the ladies that fall between 30 and 40, and you asked the question about should they start earlier? Yes, if they're first-degree relative, their mother, sister, or daughter, such as myself. My mother was 32, but she deceased at 34. They weren't going to, it's a 10-year prior to that time of the person that's affected. They weren't going to begin me at 24 because I'm too young. There's radiation involved. It's minimal for mammography, but you have to consider that person being so young. So now the guidelines are still 10 years from the onset of the person that was diagnosed. So if you have a 43-year-old mother, sister, or daughter, then you would start 33. But you have to still get a prescription. And also the key is breast exams. Always see your doctor because mammography is not 100% accurate, but it's pretty up there. But breast exam does go along with, breast health.
Oh, it does?
Yes.
Okay. And self-exams too?
Yes.
Okay.
Now, if you feel comfortable, a lot of ladies don't feel comfortable doing self-exams because it's tricky. It's, and it panics them more.
Right.
Right. So it's whatever they're comfortable with.
Okay.
The imaging tells a lot, but it's also important to examine. Just in case you discover something that feels different, you go ask your doctor.
Got it.
And they'll lead you.
What are some misconceptions that women have about getting a mammogram?
Well, number one, it hurts. And it hurts really bad. Often through my career, I've heard, oh, I'm never coming back. Or they haven't been there, and I'll ask them, where have you been? I missed you.
Yeah.
And, my last mammogram was horrible. So they decide not to come back. We have now not me, but the mammography developers have made very comfortable paddles that give a little. So when the compression is coming down, it's not like it allows it to come down more gentle. We have control of that. And it's for the amount of a couple of seconds for each exposure. It's quite fast, and it's the best tool we have to screen for breast cancer.
What about, I know you mentioned earlier about, concerns about radiation.
Yes.
Is that something that?
Yes,
okay.
that comes up. Not that often, but
Okay.
it can.
Okay.
And you take the time and you educate, because knowledge is power. Power makes better decisions in my brain.
Right.
And then you give, scenarios like if you go on a plane ride from Newark to Arizona, you're getting about the same amount of radiation that you are by a 4-view mammogram.
Okay.
It's very minimal. It's not like having a CAT scan, but CAT scans are necessary. To stay healthy, sometimes imaging you have to do.
Right.
You can't wait.
No.
No.
So you are going, to go get your mammogram. What are some things maybe to kind of ease like the anxiety that you have about it, and how do you help women get through that?
I just talk right through it with them, and I always let them lead. I'm always asking them something. Like I'll ask them, are you doing anything fun besides this today? What do you have plans for? You have any celebrations? So I try to distract them as I'm doing their mammogram. after I've gone through the whole questionnaire, why they're here, making sure they don't have any problems. And I make it about them.
Yeah.
Because it's not about me.
Right.
It's always about the ladies.
Okay.
And they're like, we're finished already? I'm like, yeah, we just did it. You know, it was great, wasn't it? And they're like off to the waiting room to get same day results.
I tell some of the moms too, because the med spa's next door, to schedule a facial afterwards.
Great
right?
idea.
Yeah.
Yes. Treat themselves.
Yeah. So because they give the best facials over at HerSpace. So what are some questions that you get from women going in?
Well, a lot of the ladies,
most common questions.
Most common questions are basically, you know, when am I going to get my results, which we've discussed. Not everybody gets the results, though. I want to emphasize that, because if you come in early bird, as I call it, you'll get a phone call later in the day with your results or an email. A lot of ladies have fear that even if we do have to do extra pictures, their brain goes right to cancer, which I understand. So I try to pull the reins back on the wild pony on them and just explain to them, what I mentioned earlier, not everything is a breast cancer. And a lot of ladies have anxiety because they feel like they're the caregiver. And if something is wrong with them, the whole family's going to suffer.
Yeah.
And I'm not a psychologist or psychiatrist, but I feel if I just let them talk, it makes them feel better. And it's simple. It's simple to just listen and be kind. And there's not a lot of questions. It's basically just the fear of what my results are. They often will say the mammo's the easy part. It's sitting here and waiting for the results.
It
is.
Yeah,
yes.
that was like a little, I was like, wait, okay. And then I think because, I needed the ultrasound, and then it took a little while. And, the radiologist came in to speak to me, but I think she was just really being nice, to say hello.
No, she wants.
Oh, she will. Okay.
She's not on everyone.
Okay. And I was like, oh my gosh.
She definitely will come in she'll come in.
Okay, good.
But even though she coming in doesn't mean it's bad news. Right.
I was sitting there and I was
here
like,
comes the doctor,
oh my gosh,
right.
I did not prepare myself for this. So, so that's something too, I think, women going in, you kind of have to prepare yourself for any type of news, which is just something that I think we just kind of have to get unfortunately used to, is just that possibility, but just prevention, right? And going earlier when you think you might have an issue.
Absolutely. And there's so many promising treatments if you are diagnosed.
Okay.
There's so many more. We know so much more. And they're in Monmouth County and even outskirts of Monmouth, there's so many talented surgeons, oncologists, the whole kit and caboodle, the radiologists. They're all wonderful. And we're so lucky to live where we live.
When we talk about any type of genetic testing, or like you said, that you have family members that have, experienced cancer already, would you speak to a radiologist and they would recommend that you go get testing, or does that happen prior?
The genetic testing is normally a conversation that you would want to have with your gynecologist. If you don't have the gynecologist in your back pocket, then you can speak with your primary.
Okay.
The first step would be go have a consultation with the genetic counselor.
Okay.
And they would be the one to go into the family tree and give you all the insight of what it's involved.
Got it.
And then if you wanted to do it or not, then they would set that up for you.
Okay. You've had an incredible career in helping to save women's lives. Have you seen, I'd assume you've seen a lot of advancements in technology, but what are some things that, now that can help with women? You mentioned just the ease of the pain, right, from the paddles of the mammogram. But what, does that ever come up with women? Now we can do X, Y, and Z, and 15 years ago, we couldn't do that.
Well, tomography is huge.
Okay.
Now, tomography's been around since 2012. Unfortunately, insurances in the beginning were not covering it. So the ladies had to make a choice for themselves, which I feel was unfair, but that's what the insurance do sometimes. They had to pay $60 to have a tomo. Now we do that across the board, and then we've been doing that for several years now. And that allows the radiologist to pan through little slices when they're reviewing your mammogram. And it can pick up tinier things that cannot be seen on the initial 2D that is acquired. Now, HerSpace, to even lessen the radiation, there's different ways of acquiring that image. We take one exposure. Some facilities take 2 exposures. And we do one, and then the computer will transform it, which lessens the radiation, which seems to be a big topic for ladies, besides the results. And we've made many advances, such as MRI can be introduced if you need it for early staging if you were recently diagnosed with breast cancer. And also if you're at a high risk profile, they may want to do like a mammo and an ultrasound, and then in 6 months keep a close eye on you by utilizing MRI. But that would go back into the genetic at your risk profile level and your family history.
So does the radiologist make the diagnosis?
The radiologist does interpret the imaging.
Okay.
Right. And they do make the recommendation.
Got it.
And we do perform biopsies at our facility. We do ultrasound-guided procedures, and those are for the lesions that are identified on ultrasound.
Okay.
And the ones that mammography detected, they're usually done stereotactically, and we'll send them to an outsource to do them.
Okay. So you have to wait for the biopsy in all cases.
Correct.
Okay.
Yes. Nobody can say you have, they can think it, they'll recommend that you need a biopsy, and they may share with you they're concerned about it. But nothing is definite until you get the biopsy, get the tissue sample.
Okay.
Right.
And then from there, the gynecologist kind of puts you in touch with who to consult with after that?
Well, our radiologist that does our in-house procedures, she will call every patient that she biopsies and the other doctor as well, and then guide them to a breast surgeon.
Okay. And
we also include the referring physicians, because they may also want them to go to a certain physician. And so they don't get they get the results on my chart, which is not a good thing, but that's the way my chart is now. You have to allow
get emailed, right?
Right. So we let our patients know, the radiologist tells them that you may get the results even before I get the results.
Oh.
But she'll always, and the other physician as well, he will always call the patient and have a discussion with them.
Okay.
So they're not just, worrying by themselves at home, so they'll guide them.
And then when you are diagnosed, do you continue to come back and get mammograms while you're going through treatment, or how does that work?
Not during treatment.
Okay.
If you opt to have a lumpectomy, with a lot of ladies do, yes, you'll continue. They normally will come back in 6 months after their surgery and their treatment. If they have mastectomies, there's no longer a need for imaging for mammography.
Okay.
If both the breasts are removed. Some people do prophylactic. If the one breast has the breast cancer, they may do the other breast. We don't image the side that was removed, even with an implant. But it's still important to do physical exams, and because if you feel something, then we would do an ultrasound.
Okay. From your experience, do most women come each year, or is that not really the case?
I would say a high percentile of ladies do come in when they do, but there are some slackers.
Yeah.
But, they get back on track.
Okay.
I always tell them, if it's my lady, I'll say, I'm going to get my little bus out and I'm going to pick you up next year. Or I encourage them to go to the front desk and make their appointment for next year. And if they have to change it,
he reminds you that at least
you have it, and you're committing to take care of yourself.
Yeah.
I don't beat them up.
Okay.
I actually congratulate them, and when they don't come in regular, I say, I'm so proud you came in, and you should be proud of yourself as well.
Yeah.
Nobody's going to take care of us but ourselves.
Oh, it's very true. I was at an appointment. I'm sorry. I was on the podcast, and one of the providers that came on, it was a separate topic, but I was talking about some back pain that I was having, and she said, you have to invest in your health. And it kind of struck me, because you're always on the go, and life is busy, and it's just, you're kind of just getting through the day a lot of the time with all the kind of at front tasks that you have. But the days go by quickly and the years go by even quicker. And I think if you're not, making that choice really to like invest in your health, it's, only going to hurt you in the long run. So, so make those appointments for the mammograms, ladies, right?
Absolutely. We're
Yeah.
only a phone call away.
Yeah. Where can everyone find HerSpace? It's in Little Silver, right on White Road, right?
White Road.
Yep.
200 White Road.
Yep.
We're Suite 115.
And we'll put in the notes here what the website is to make an appointment. The team it's a really very nice, relaxing atmosphere, environment. It's very soothing, it's very inviting, very warm, right?
Mm-hmm.
And everyone is so nice. So, it's definitely a great place to go when you have to, when you have to get the mammogram done and get hopefully good results, right?
Right.
Right. So,
Yes.
We will, like I said, we'll put the information there. Thank you so much for coming and, just sharing your story and giving some insight into your incredible experience helping women throughout the years. And I will continue to come each year, and hopefully we'll have good results moving forward.
And I'll be there
right?
for you.
Yes.
Yes.
Thank
And
you.
I'm there for everyone that wants to come to where everyone loves what they do. My colleagues, my peers, we all have the same mission in life, or else some places don't provide that, but we have a great team and we all do the right thing and we love to take care of people, just not me.
Well, thank you so much. I appreciate it.
Thank you for
coming.
having me.